Okay, we are rolling. What's the difference in seeing an integrative medicine MD like yourself versus a naturopath, chiropractor, homeopath, herbalist, or alternative doctor?
Great question. Being an integrative medicine physician, I get to provide the patient what we consider the best of both worlds, or all worlds. So we have conventional training in conventional allopathic Western medicine. We get an MD. Most of us have a residency specialty, like mine was family medicine, but some people do internal medicine, or even specialties like cardiology, for example. And then they do a fellowship program, so it's going further training into integrative medicine. I was lucky to be one of the first integrative formally trained physicians and fellows in the country 20 years ago with Dr. Andrew Weil at the University of Arizona. And then after that, subsequently, I studied functional medicine, Ayurvedic medicine, acupuncture, neuroacupuncture, homeopathy, homotoxicology, physiological regulating medicine, and herbal medicine, and then eventually went into plant-based diet and lifestyle practices. And so this gives us an opportunity. What's different is that since we have the best of both worlds, chiropractors are limited, naturopaths are limited in what they can do conventionally. They can't order certain types of labs, they can't prescribe certain type of drugs or certain type of procedures, and vice versa. So the idea is, instead of seeing certain practitioners, a truly integrative practitioner has the ability to provide you like a one-stop shop of like all these different specialties. Now, each integrative practitioner may have certain experiences. Like me, I'm a little bit different because I've done a lot of training in my life because I started really early. But for most people, it's like they can get the understanding like what an herbalist will provide. An integrative practitioner, if you find a good one, they'll be able to provide just the same thing. So it's kind of like, instead of seeing many people, you're seeing one specialist, but that specialist has multiple modality training. And then that's nice because you're getting everything. And our goal as an integrative practitioner is always improving the outcome. And it's not polarizing or saying, this is better than that, don't take this, don't take that. So it's an outcome-driven, evidence-based, looking at the least invasive, cost-effective measures through diet and lifestyle first. And then if we do have to use things like prescription drugs or surgery or some kind of, a little bit more invasive modality, then it's like, how do we improve that outcome and lower the risk of side effects?
When do you recommend using pharmaceutical drugs versus herbs versus supplements versus food versus something else?
Western medicine is good and is best at acute care. So usually when someone, and that's usually relegated more to the emergency room or urgent care options. And so if someone comes in, they have a dog bite, or they have some kind of wound, or they're very severely sick and they're immunocompromised, for example, then Western medicines are good, acute issues. So for example, if someone comes to my office and their blood pressure is 210 over 110, and we get people all the time walking in with uncontrolled hypertension. I've not seen a doctor in 10 years, usually men or more. And we look at, how do I give a drug? Because I need to acutely clamp down on the physiology because it's more of a dire situation, right? I need to get them out of the risk of having a heart attack and stroke right now. But what we want to do is not just keep them on the blood pressure medicine. We want to look at changing the diet and lifestyle, all the epigenetic factors of their life, lower that blood pressure naturally. And then if they need to, we can switch them over to a natural herbal medicine that we actually have for blood pressure that works very well because it has least side effects rather than some of the conventional drugs, and eventually wean them off of even the herbs because really it should be the lifestyle that maintains their health.
Are the medical journals providing the most honest, up-to-date information on health and healing?
Wow. No, because the concept is, are they talking about science or scientific methodology or pharmaceutical drugs and clinical trials? Yes, but healing is not a part of that. So one thing that people forget or they don't understand is that in conventional medicine, the word healing is not even taught, right? So we can remove something, we can suppress something, we can treat something. That's different than healing. And so I'll just give an example for cancer. It's easy for oncology, as we say, to kill cancer. There's a lot of things that can kill cancer, radiation and chemotherapy, and that's sometimes indicated depending on the patient and the type and stage of situation that we're in. However, that has nothing to do with healing. And so through an integrative approach, we're looking at how do we, again, improve the outcome by giving you the best of everything. How can we give something that's targeted and lower the risk of side effects? Or, more importantly, how can we maybe avoid some of these things that have side effects and use something more natural?
In Chapter 1 of Inflammation Nation, what did you mean by inflammation, the common link to all diseases?
So inflammation is what we consider the triggering mechanism of all disease. So at the earliest stage of any disease, A through Z, and I'll tell you in a second what that might be, is that there's an inflammatory response. Inflammation means fire, flam, and basically the word means itis, I-T-I-S, right? So anything that we put at the end of the word itis just means inflammation of that area. So if you start from the head, like say someone has itchy scalp, they go to a dermatologist, we call it dermatitis. We can get red eyes, we call it conjunctivitis. Runny nose, rhinitis. Stuffy nose and pain, we call it sinusitis. Go to the dentist, we have gingivitis. We can then have, I'm having a little bit of laryngitis with my throat here, talking a lot. People can get sore throat, pharyngitis. People can get a thyroiditis. Heartburn and reflux and stomach pain is esophagitis and gastritis. People can get colitis. Men can get prostatitis. Women can get vaginitis. We all can get arthritis, tendonitis. So there's almost 200 different itises now in the medical diagnosis compendium. But the idea is that we have to look at what's the underlying triggering mechanism that comes into that patient and their diet, lifestyle, environment that triggers these inflammatory responses.
In Chapter 2 of Inflammation Nation, what did you mean by an introduction, 10 steps to optimum health and longevity?
In my experience over the last 20 years being an integrative medicine physician and specialist in this area, we've looked at what were the epigenetic changes or factors that have been proven in science that we need to do with diet, lifestyle, environment, and belief system. And so over time, watching my patients' profiles and also changing my health in the meantime, we looked at what are the steps. So I created this book for the reason is that when I spend time with my patients, usually 2 to 3 hours per patient, okay? And I'm booked for many, many months. And so the idea was to create a book that people who can't come see me, they can still follow the 10 methods. And these methods are proven. The book has over 450 pages of information, but over 1,500 scientific references and studies and investigative journalism as well, because there's other parts that we look at in health, to look at, this is the stuff that we need to give to patients to empower them. And if we empower them correctly, 80%, if people follow these 10 steps, 80% of their condition will resolve. Okay, why is it not 100%? Because that's when you need an integrative or some kind of healthcare practitioner, because most people will be on medications that might need to have some tuning or even a weaning off, and some people might have other chronic issues that might need some more laboratory testing or some more other evaluations. And so, just following this as a basic guide, even if you don't have an integrative practitioner, you can improve your health dramatically.
In Chapter 3 of Inflammation Nation, what did you mean by Step 1, eating an organic, non-GMO, plant-based, anti-inflammatory diet?
So at the end of the day, the first step that everybody just always go home with is you have to be eating good food, right? Food is medicine at the end of the day, as everybody says, right? But we have to understand what type of food. I always give the analogy that, to my patients, think of your body as a Ferrari, okay? If you have a $300,000 car, you can only put good fuel in that car to run. You can't put cheap fuel. If I tell people, if you give you keys to that car right now, and if the car was on empty, you be very careful which gas station to go. I want a special octane fuel for the car to run. NASCAR fuel, for example. You're not going to go to a cheap pumping gas on the corner, right, for a low price. But for a strange reason, we don't treat our body the same as our car. So we actually put in cheap food, we put in cheap fuel, and then just like a car, if I put diesel into a Ferrari, it's going to start pinging. Then we're going to go to the mechanic. The mechanic's going to say, you got all these things wrong with you. We got to remove this. We got to, same thing with doctors. We got to remove this, or we got to rechange this out, right? So we have to look at starting with a whole food plant-based diet, which is anti-inflammatory. So at the end of the day, we have to look at what foods are anti-inflammatory, which ones are pro-inflammatory. So before people get into like what's an animal protein or what's a plant protein, I just say, is it pro-inflammatory or anti-inflammatory? And if it's pro-inflammatory, you shouldn't be eating. If it's anti-inflammatory, you should be eating more of that.
In Chapter 4 of Inflammation Nation, what did you mean by Step 2, testing what is triggering inflammatory responses in your body?
So the key of looking at individualizing healthcare is not just moving to a plant-based diet, because we already know that that's what all the science says. All the studies will show unanimously, right, is that we should be using a whole food plant-based diet to reverse almost every single disease or prevent it from getting worse. Okay? But we have to then look further. What we do that's different than most practices, that we look at individuals' responses to all foods. So for example, where sometimes people will fail going to a plant-based diet is that they transition, say, oh, I watched this movie, The Game Changers, for example, a great movie, or Forks Over Knives, or What the Health. And they say, I want to change my life. I want to change my diet. But if they have a food sensitivity of some kind that they don't know, then they're inadvertently eating more of those foods, and they actually can trigger an inflammatory response. Food sensitivities are interesting because a lot of people were thinking about food allergies. And in my book, I'll talk about my food allergies, particularly, where I have an anaphylactic reaction to nuts, for example. So most doctors and most patients think of these life-threatening, you eat something, your throat's going to close up and you need an EpiPen or you need to go to the hospital. But there's a lot of other type of reactions that people can have that happen within an hour that's not life-threatening. It's called an immediate reaction, but it's not life-threatening. There's also a different type of reaction that can happen a few hours up to 4 days later after the patient consumes. It's called a delayed. And so what happens is when people move to a plant-based diet and all of a sudden they're eating a lot more berries and seeds and nuts and mushrooms and onions and, and beans, you can still have a sensitivity to those, even if they're organic. So what we want to look at in our practice is individualizing the diet. So it's not only going to what the science is of plant-based diet, but looking at each person's specific immune system function and looking at, is everything still anti-inflammatory, or if there's something pro-inflammatory coming in from an immune perspective, let's remove that. Some of these things we can reintroduce back into the diet, but the elimination of all those things gives the perfect health.
What do you do when a patient comes to you and says they have gastrointestinal problems? And what do you recommend they do? How well does it usually work?
So most people in America actually do have some kind of GI problem, right? You can go to the store and you can see the whole aisle of, here's your, purple pills and your antacids and your, and then you have the, the products for the constipation and the diarrhea. So all these IBS symptoms are all actually inflammatory-based symptoms. Okay, again, GERD is just esophagitis, gastritis, colitis. All these aspects are inflammatory triggers. And so when patients come to me, we first look at the diet. We first look at what we should look at that are foods that are coming that may be potentially triggering those inflammatory responses. And then more importantly, we investigate their microbiome. So every patient, what we look at is when we talk about their microbiome is your GI tract, right? And 80% of your GI tract is where your immune system is located. So we like to look at the individual aspects, and now there's testing that can be done where we can look at how is your digestive enzymes. Are you breaking down your foods like proteins and fiber and fat? Are you eating enough of those? Is there any kind of inflammation in the bowel? Is there any kind of overgrowth in the bowel, like a small intestinal bacterial overgrowth or fungal overgrowth like a yeast or a candida or even a parasite? Right? And now once we have that aspect, so we can actually retarget, restructure, restore this GI tract. And so the GI tract is the first place where everything comes in, whether it's a medication, whether it's a food, that's the first point of entry. And if we fix that point of entry, then usually that initial trigger of inflammation is stopped in its tracks. So we always have to look at doing that. Now, you asked, the question was, how often or how well does that work? Well, it works in everybody. The question is, are they willing to do the lifestyle changes to continue to maintain that healthy lifestyle? And that's the challenge. And so what we like to do is we like to teach the patient, how to shop, how to cook. Here are the ways that we keep them motivated. Can you also develop a community where you can eat very similar foods and participate in activities where you're not constantly insulting that GI tract with, either improving your immune system so you can get less antibiotics when you're sick because you're stronger and your immune system is stronger. How do we actually look at eating healthier foods like organic foods, so where there's less pesticides, herbicides, endocrine disruptors that cause dysfunction in the gut? So the challenge is easy to fix everybody's gut, even patients that have colitis. That's our easiest patients to change. Anybody has autoimmune disease or anybody has like IBS, simple. The question is, are they healthy enough or responsible enough in a way to not fall victim to what the system has, here's the convenience food, here's the easy pill to take so I can treat my symptoms. But if we go to the underlying cause of disease, all diseases can be reversed.
Are there different types of food sensitivity, reactions, and testing?
Yes, so there's two types of reactivities with foods. And again, some people call them allergies, some people call them sensitivities because the word is really broad. But in essence, there's an IgE, there's an immediate reaction that people can have within 1 hour. Again, Western medicine's been trained for that 2%, like for patients like me, that we can eat something and have a serious reaction, anaphylaxis. So you'll hear nut allergies, melons, and certain people like, oh, I have a peanut allergy, I have a shellfish allergy, for example. So those are very rare, but they're very serious. So we're good that when people get those type of reactions, we have Western acute care, right? We have an epinephrine, we have steroids. If we have to, we can intubate someone and put them on a ventilator, right, and save their life. That's happened to me many times in my lifetime, by the way. So I'm really proud and really happy that we have acute care in Western medicine. However, the chronicity of diseases is the second aspect where they're delayed foods, where you can eat a food and anywhere from a few hours after you eat up to 4 days later, you can then get an inflammatory response. Remember, that inflammation goes systemically. So wherever there's an itis in your body, that will trigger that to get worse. Now, what we have to look at is that many practitioners, conventional doctors, only look at IgEs, and they only look at the anaphylactic ones. So they may only pick 5 things: eggs, dairy, shellfish, and peanuts, right? And eggs, for example. So they're only looking at, are you going to die right now today in my office? And this is something I can give you. But they're not looking at the whole spectrum of all the foods you eat because they're not concerned about things that can be not life-threatening, but also life-devastating over time. Likewise, alternative practitioners can only order delayed foods, because they're not doctors in the MD world. So they can look at delayed foods, but delayed foods can have problems because delayed foods can have false positives, and also delayed foods are things that also are temporary. These are things that we can eliminate from the diet and then rotate them back in the diet in a specific fashion, which will educate our patients. So a lot of people get testing, they're either not tested fully enough, or they're testing and say, oh my God, I'm allergic to everything, I can't eat anything, right? The goal is that they need to have the specific guidance, and we have the experience on how to provide that.
How important is the microbiome, and can that be tested?
Yes, so as I was mentioning, the microbiome is everything. Right now we're in the science where we're just touching the tip of the iceberg of the microbiome. Again, 80% of your immune system is in the GI tract. So we have to look at, how do we feed those probiotics? And those are our immune system. So when we think of, there's 100 trillion colony count of over 1,000 species that weighs 4 pounds. That's a lot of nice organisms in our gut. But there's also aspects of dysfunction and overgrowths. So we have to look at, how is this digestion, absorption, assimilation, and excretion, how is this working? Because you can eat the perfect diet, and if your gut's wrong, you're not getting the benefits. You can take the perfect supplements. If your gut's wrong, you're not going to get the benefits. You can pick the most advanced drug, latest and greatest medication, and again, so there's a rate-limiting step, and that's the GI tract. So we always test the microbiome, and then we restore it, we correct it, and then that's when medications, drugs, and supplements, and even food becomes medicine.
For people who have dysbiotic bacteria, fungal overgrowths, or parasites, do you recommend antibiotics, or is there some other natural approach? Do they use antibiotics for this in the other 200 countries outside the US, for that matter?
So to answer that question, we like to investigate and actually test the microbiome specifically. So we don't just go off of symptoms. So a lot of practitioners will be, especially in the alternative world or sometimes in the holistic world, like chiropractors and naturopaths and just other healthcare practitioners, they'll go, oh, you have gas or bloating, and it sounds like candida, and then give a candida product, right, or a candida cleanse or something, right? Or it sounds like parasites, and they give. So every practitioner has their kind of old, I think it's this. Even GI doctors, they'll go, oh, I think it's small intestinal bacterial overgrowth, SIBO. Here's a $2,500 new prescription drug that will kind of kill those bacteria. But all those things are not as targeted as we want. What that means is that when we do microbiome testing, from the patient's own results, it is tested to look at sensitivity and resistance. What that means is that what is those microbes, if they're bad ones, or they're overgrowths of those good ones, which drug do we give, and which herb can we give that is sensitive to it? So we don't give what we prefer. Doctors like to provide this, or herbalist will be, this is my favorite herb, or the patient will be, I love to take this over the counter. It's like, what actually works? Because when we go into the gut, I look at the gut-like history. We can't just go in and invade without true weapons of mass destruction. You have to have evidence, because if we go in and we cause that, if we go in and we invade, then we're actually going to be there for a long period of time, as history has told us. So what happens is, what people don't understand is that natural products also knock out good stuff, right? This is antimicrobial. So last night we were at this, the conference, we had a wonderful panel, and people were talking about antimicrobial herbs. And I was like, yeah, that works. But you have to have the guidance, because these are just like antibiotics. You wouldn't take antibiotics every day for months. But a lot of people take, oh, I had candida once, and they might have. And then they take an anti-candida product daily for months. And I'm like, but you wouldn't take an antifungal daily. You wouldn't take amoxicillin daily if you had a bacterial overgrowth. So this is where people don't understand that they have to respect the plant medicines are medicines, and that's why we can give an integrative practitioner can give that guidance, because we have to give these things targeted for a specific amount of time, but also help restore that gut, because again, even things like oregano and uva ursi and berberine and all these things also can have negative side effects if you take them too long or untargeted use.
What is leaky gut?
Leaky gut's a great term, actually. Right now, 20 years ago when I finished my fellowship, leaky gut was a term that was used, and it was almost, people said it didn't exist. And now there's conferences, in GI medicine with the term leaky gut, because it's an easy term for the patient to understand. So when we look at the microbiome and we look at the cellular function of your GI tract, okay, there's these little, what they call tiny villi. So if we did an endoscopy or a colonoscopy and you look at a picture of someone's GI tract, it just looks like this pink tube. Most people get their report from the doctor and be like, here's a pink tube. And what we're looking for is usually like a polyp or a tumor or a bleed or outpouching or something that you can physically see. That's the gross pathology that we're looking at. But when we're saying leaky gut, we're looking at the cellular function. when food and all the nutrients are there, like the carbohydrates, the fats, the protein, vitamins, and minerals, how is that being absorbed in this tube? We can't see that from a gross picture with a scope. But when we look at a microscope into those little cells, there's these what we call tiny little villi. It's almost like velvet, okay? And this is what the surface area of the GI tract is. In fact, your GI tract is about 30, 35 feet long, and that surface area is about 2 tennis courts worth of surface area. Okay, so how does all this stuff get absorbed? That's what we're looking at with leaky gut. Because when we take antibiotics, when we take chemotherapy, we get a foodborne illness, or we get other type of thing like a gastroenteritis from a virus, for example, that destroys and creates dysfunction. I'll give you an example. 1 pill of an antibiotic can cause GI dysfunction up to 18 months later. Right? Now, we do need antibiotics. We're not against antibiotics, but a lot of times they're dispensed too quickly for a viral infection, for example, or a simple urinary tract where we can get rid of it with other things. It's like, oh, here's a Z-Pak, or here's a Cipro, or something. And people come to my office and they're like on the 6th time in the last few months. So this develops resistance, but it keeps knocking out their microbiome, which then lowers their immune system function, so they're more prone to get sick again, and the cycle goes on and on. Okay? So we have to look at restoring that, and then when we look at giving something very specific, we have to be targeted.
How do you know that a patient might be deficient in a vitamin or mineral?
So that's a great question, because when we look at patients in terms of deficiencies, we actually test for that. A lot of the doctors here were saying, eat more of these foods, to get these nutrients. And that's what we should be doing for everybody. Eat more vegetables and fruits and beans and greens and, onions and mushrooms and seeds and berries, all those plant-based foods organically as much as possible. But we have to look at each person as an individual. That's, again, we're individualizing medicine, because it's not just putting it in a computer program saying eat more, or I think you're getting this. It's like, what is your body absorbing? What is the levels? So just like when people check their blood pressure, that's your blood pressure. When they check your cholesterol, your blood sugar, that's your blood pressure or cholesterol or your blood pressure or blood sugar number. So we actually test the nutrients, and we're able to test all the antioxidants, A, C, E, CoQ10, glutathione, all the B vitamins, not just B12 that most people in folate just check. And we look at all the minerals like zinc and molybdenum and magnesium. These are all important factors in health. We look at the omega-3s, 6 and 9s. We look at heavy metals. We look at detoxification pathways. Even how you convert these things metabolically is what we look at, because it's not just giving something. It's like, do we need to give it for a reason? So for example, supplements supplement the diet. They never replace the diet. So a lot of people are redundant. They're like, I eat a bunch of this stuff and then I take this supplement, which is basically the same thing. Well, we want to look at if there's a deficiency. That's when supplementation can be very helpful, because that's raising those levels up to normal, and then they can maintain by the diet, right? But until then, a lot of people are just, they're missing something. So if you miss something, there's pathways in the body where each nutrient, for example, each vitamin and mineral, they control thousands of reactions. They sell something in the store, vitamin A's for this, vitamin E's for that, but actually it can be in every single section of the store, because when you eat kale or you eat a blueberry, there's thousands of compounds in there that do all these things. We only put one kind of action on each bottle because we can only remember one thing sometimes at a time, right? So we have to understand that when we look at nutrient testing, it's key, because a lot of people just say, well, I think you have a deficiency, or I think you need this. If your levels of CoQ10 is normal, why should you take CoQ10? Well, unless you're an athlete or you have some kind of, I'm going to do a challenge, or I need to get a little bit more energy if I'm going to deplete it. But if, that's also an expense and out-of-pocket cost for the patient. So we look at, if you're deficient, that's where your money, you get your biggest bang for your buck, and then we can actually target those therapies so that when people take supplements, they can actually say, I do feel better. I take this herb, I do feel better. I took this product, I do feel better. Without that, most people are like, here's my bag of this and here's my bag of that. How do you feel? I feel terrible on all these levels, right? And so we want to make sure that we can kind of pare that down, and the things that are redundant or things that we don't need, that should be put into eating healthier diet.
If someone eats a whole food plant-based diet, can they still have nutritional deficiencies?
Yes, and that's why we test. So looking at the microbiome, looking at food sensitivities, looking at things that trigger inflammation, and actually looking at the nutrient levels. So for example, if you or your partner were eating the same foods and eating the same supplements and doing the same juicing and all these other things, your tests are going to be completely different. Because we're not robots, not 100%, not 100% out. Someone might have a little bit more loose bowel movement, someone might have a little bit more constipation, some people might have other health issues that have malabsorption problems, or some levels might be too high. So we have to be very targeted. Now, the best part of testing is then we know how much to give. So it'll be specific. It's not just like you're low, it's going to tell you how much to take. But even better, what we like to do is that our tests will then show what foods you should be eating more of. So it's not just, oh, here's another pill, here's another vitamin or mineral. I'm going to say, here are the foods that you should be eating. Eat that 3 times more a week to get, because when you take it from the food, you're also getting all the other aspects like the protein and the phytonutrients and the fiber, not just say, for example, the antioxidant. Unless it's super deficient, then that's when targeted therapies can have wonderful benefits.
In Chapter 5 of Inflammation Nation, what did you mean by Step 3, detoxification, clearing the toxins?
So all of us have some kind of toxin overload, right? But that word is totally misused in Western culture. In my book, I kind of go into the real detail of what true detoxification means. Detoxification actually comes out of India, Ayurvedic medicine, where they have a program called Panchakarma. And that's going to be detailed in the book, so those people who want to know a little bit more about Panchakarma, that's a specialty that we do in our clinic in Sanjevani in Albuquerque. And that's something that is in Ayurvedic medicine. It's how do we detoxify the body, but it's not what considers. Here in the United States, people do a 7-day colon cleanse, or I'm going to drink wheatgrass or green juicing. You know, that's kind of a bowel cleanse in terms of like you're just having a lot more fiber and greens. But we're talking about true detoxification. How do you actually move the toxins from the mind, the body, all the tissues? And so in Ayurvedic medicine, it's a series of treatments. It's not just a simple kind of cleanse. And so when we look at detoxification, we have a specialty to do that. Now, for the just general term of detoxification, if people move to a whole food plant-based diet, and if they're eating an anti-inflammatory diet, and when they get to the 40 grams of fiber that they need a day, that's normal detoxification. Having 1 to 3 normal, well-formed bowel movements is just regular physiological detoxification. Everybody wants to sell a detox smoothie and a detox program, and this is the hot word in the last 5 years, particularly on social media. But that's a little bit of a false narrative, and that's usually sold by people who are just selling products. They're looking at how do we actually eliminate these things. Is it actually a science and an art? But it's not just like I take this and opens channels and I get rid of it. That's really minimalistic understanding of physiology, anatomy, and immune system. So once people understand true detoxification, that's when there's an actual ability to not only eliminate, but also strengthen the system as well.
Do you recommend colonics or coffee enemas?
No, I don't recommend coffee enemas or colonics. And the reason being is because it disrupts the microbiome. You know, some of these alternative practices are really new. You know, when we look at Ayurvedic medicine for 4,000 years and Chinese medicine, and we go to African cultures and we go to Asian cultures and, you know, South American cultures, we don't see this kind of therapy ever given, right? Water is a drying agent. So actually water actually dries the internal side of the colon and actually causes more of a drying effect. So even in Ayurvedic medicine, when we do something called a basti, which is like an enema, it's used in oil because we never use water, right? But we were never intended to be like Jiffy Lube. We never just supposed to go and like, let me flush. Now, most people will feel better because most people are constipated. You know, the average person we see is having if they're constipated, they're having a bowel movement every other day, every 3 days, every 5 days. In fact, the other day I had a patient that came in every 6 to 8 days of bowel movement, right? So this is normal, right? So, but that's abnormal just to say, well, let me just hook you up and flush you. Now, coffee enema, same thing, because, you know, it's best to drink the coffee from above. You can get all the polyphenols and antioxidants, again, organic, you know, not more than 2 cups a day. But the idea of like stimulating something via the rectum to get that benefit is a little bit of trying to bypass the story of like understanding physiology, right? And the worst thing is that it does disrupt microbiome. So we now, since we do microbiome testing, and we have patients who go get colonics, or they go to, you know, some kind of alternative cancer facility, and they do these coffee enemas, we can actually show the disruption. Because once you flush out those probiotics in the gut, you cannot replenish them. So that's the key thing that people need to understand, is that when the microbiome is dysfunctional, you just can't say, I do a colonic and then just take a little probiotic. Remember, there's 1,000 species. We usually give 12 to 15 in a pill, and you know, we give maybe 1 billion, 10 billion. We give 100 billion, right? But there's 100 trillion in your gut of over 1,000 species. So you can never make that up. If someone takes all the supplements in the marketplace, there's about 50 to 60 species of probiotics that are available. Again, you have over 1,000. So it actually causes more dysfunction because you cannot replace that very easily. So I'm very cautious, and I would recommend people not to do colonics and not to do coffee enemas. If they were eating the proper diet, you wouldn't need to have that. The problem is most people don't eat the proper diet. So it's, again, it's the quick fix. You know, it's just another pill in a therapy form of treating a symptom and not going to the underlying cause.
What about green smoothies and juices for detoxification? Do you recommend green juices made of organic green vegetables and sprouts?
So again, the word detoxification is misunderstood. So people say, and I see it all the time, and I get all my patients come in, they're like, oh, I'm doing this green smoothie program, and it's detoxifying me. It's like, no, you're eating some healthy food. But the problem is some of those programs, and almost most of them that I've seen, is that they're not nutritionally sound. So is drinking a green juice healthy? Yeah, it's better than drinking a soda. It's like the more that you can cram in more greens and vegetables and fruits in your diet, please do. But to say that this is going to magically do that, what most of the people who have created those diets have not understood nutrition. So they're actually lacking. If I just eat 2 greens and put a few vegetables or fruit, it's healthy. But then they're still missing most of the carbohydrates, the proteins, the fats, all the 33 essential nutrient vitamins and minerals because they don't understand nutritional foods. So there's a little bit of a limitation. Is it healthy? Sure. Is it truly doing what they're saying? Not necessarily, right? And so we actually have protocols that we look at that if someone wants to do a juice protocol, here's all the things that you need to put in if it's going to be a true meal replacement. Otherwise, a lot of people will go through the detox. They're getting actually lack of their full nutrient-dense foods that they need, and they say, oh, I'm feeling tired, I'm feeling exhausted, but that's the detox reaction that they told me I'm supposed to have. I'm like, no, you're not getting fully nutritious food. And there's a difference of that. So that's why we have to look at moving, right now, the word even nutritionist on the internet means nothing. Everybody's now a health expert that has millions of followers and sell programs. We have to look at, is there science to back their claims? And if they are providing a product, then does it have the best ingredients? And is it, even if it's a recipe, is that recipe giving them exactly what they need? And what we find is that most of them fall short.
In Chapter 6 of Inflammation Nation, what did you mean by Step 4, avoid smoking? And what about vaping?
Yeah, so we shouldn't be smoking. Hopefully most people watching this aren't, but believe it or not, a lot of people still do, right? Smoking is, is the second most common cause of cancers, okay, aside of diet and lifestyle. So tobacco use is terrible because it causes so many other problems. We already know that. We had the data. It's risk for cancer and other chronic diseases. However, the concept of vaping now is on the upswing. As we know that there's a lot of legislation recently trying to be pushed to try to, limit the sales because young men and women right now, teenagers, are being marketed indirectly. Right? There's a lot of federal lawsuits for billions of dollars now because companies overnight, just like what we did with cigarettes, were giving something that was quicker and faster. Vaping is not safe. And in fact, there's not only vaping dangers of the ingredients that were put in vaping, but vaping is designed to keep the person more addicted. So, tobacco used to have about 3,000 chemicals in a cigarette. Okay, that's where industry could dump other people's products because it was a waste product. And you can smoke it because it wasn't supposed to be a health product. And if you got cancer, well, that was your problem. You knew the risk, okay? But with vaping is that they say, you know what? We don't necessarily want to cause cancer. It does cause other problems, but we want to get you hooked better. Because what they understood in the tobacco industry is that people would smoke for a long, long period of time, eventually get sick and then die. But then over time, they were dying too soon. They want a long-term consumer. So what we do is let's eliminate all these other bad chemicals and let's give you the pure product. And then we mask it with flavors, we mask it with other neurochemicals that have not been tested. The companies understand what they do, but the government hasn't had it. It's all private data. And so they take that and it instantly goes to their brain and it's at a higher level than even smoking a cigarette. So now we got someone who's a teenager who's definitely addicted as if someone was smoking for many, many years. And that's why it's a difficult thing. So we recommend not vaping, not smoking. Now, we can provide other aspects of how do you get that body's physiology to be balanced when someone says, hey doc, I'm interested in stopping smoking. I'm interested in stopping vaping, And it's hard because almost everybody you'll see now doing this little smoking, little things at school, in the lockers, in the parking lots, everywhere's hiding it. So we have to look at it from a social policy that we have to prevent these children and adults really from really being stuck because it's not their fault. If you start vaping, you're going to be stuck. I mean, so it's like preventing them to understand that this is not a safe alternative, which is how they kind of indirectly market it, is key. And we understand that the long-term detriments are there.
In Chapter 7 of Inflammation Nation, what did you mean by Step 5, avoid NSAIDs, the unknown dangers?
So NSAIDs are what they call non-steroidal anti-inflammatories. It's one of the largest classes of over-the-counter medications. So when we think of things for inflammation, most people will go to the store and they'll say, oh, I want to buy some ibuprofen, which a brand name would be, say, Motrin or Advil. Or I have a prescription for Celebrex, which is Celecoxib, for example, from my orthopedic doctor. Or they'll get naproxen, which is a brand name like Aleve, for example. So we take this to help lower our inflammation, right? They're anti-inflammatories, non-steroidal anti-inflammatories. However, they all come with a black box warning. And so what a black box warning means is the following. Every drug that's that's approved by the FDA has what we call a common side effect and a serious side effect. A common side effect occurs commonly. So with NSAIDs, all these things I mentioned before, you can get a little ringing in the ears, some swelling of the ankles, some gas or bloating, diarrhea, heartburn, maybe some rash. Not devastating, not dangerous, just uncomfortable, okay? But they also can have a serious reaction, and certain drugs that have serious reactions could be a heart attack, stroke, GI bleed, it could be even cancer or some kind of blood disorder or something like that, very serious. Serious things occur rarely, common things occur commonly. However, once a serious reaction starts to occur commonly, then the FDA has to put out what they call a black box warning. Now, black box warning basically it means that you can end up in the black box. And it's not a lot of doctors thought it was the little black warning with the little box. No, the black box they're talking about is the casket. That is the black box. That's the kind of the double entendre of the government. It's like, this is the black box because that means you can take this and that can put you in the black box. So now all NSAIDs have a black box warning for heart attack, stroke, GI bleed, stomach, intestinal perforation. So 1/3 of the American population takes this product every day. And we have to understand that, you don't have to be taking this all the time to have this problem. A simple college person, a female, just for her menstrual cramps can take one or two of these tablets just once a month and bam, have a GI bleed. Someone can be, oh, I'm plant-based, my cholesterol is perfect, I can take this for a back pain or headache, and wow, I have a heart attack, right? So we have to look at this is a big problem. Now, why don't they take it out of the market? Is because once there's a black box warning on a product, every time you tear open that package, twist open that cap, take it from the pharmacy, once you open it, you've accepted the terms and conditions herein that black box warning can happen. So let me explain that again. Once you tear open the package, once you open the bottle, you've accepted the terms and conditions that the black box warning of the drug that you're taking can happen. And therefore, there's no legal liability to the manufacturer. Right? So what happens is now we have over 30 different generic companies now that are making hundreds and hundreds of, well, there's Walprofen and there's CVS Profen and there's, you name it. You can open your own company and just get ibuprofen because it's a generic supplement, generic over-the-counter. And that over-the-counter, since there's no liability and so many people take it every day, let's just give it. Now, for those people who say, well, I've been taking this for a long time and I haven't had a stroke or GI bleed and stomach or intestinal perforation, we know that right now for joints, for example, the studies will show that within 2 years of someone taking this consistently, so a lot of people are taking ibuprofen every day or Aleve every day, is that we can start seeing degeneration of the joints. Okay, it disrupts how the collagen and the amino acids and the hyaluronic acid and the joint function is there. These are all clinical studies in orthopedic journals. And they can follow the patients over time with serial x-rays, and they can show within 2 years starting to have deterioration and damage. So the thing that they're taking it for, arthritis, actually contributes to their arthritis getting worse. And that's why most patients, when they come to see us, it's like, oh yeah, I used to take an ibuprofen once a day. Then it went to, one twice a day. Then it went to 2 twice a day. Then it went to, I take this and then Aleve. And now I go to my orthopedic and now I'm on Celebrex. So the concept of what they call addling or adding on is actually contributing to the disease that they're trying to prevent without no one really telling them. But again, you've signed the agreement once you take it. So this led me then to look at what can we give using natural anti-inflammatories that are safe, natural, and effective.
In Chapter 8 of Inflammation Nation, what did you mean by Step 6, decrease inflammation through the use of Boswellia SR?
Okay. So Boswellia SR is our flagship product. This is something that we've worked on over a decade. We've had 6 years in the research and development as we're looking at 4 ingredients, 3 which are patented, and looking at how can we make the strongest natural anti-inflammatory available. We use 4 key ingredients. One of them is Curcumin C3 Complex, which is the gold standard now of curcumin. Now, a lot of people will hear curcumin. They don't know the difference between a curcumin and a turmeric, which I'll explain later. But when we combine these ingredients at the right doses, these are products that have clinical trials. So it's not just in a test tube. It's not an animal anymore. Now we actually have human patient clinical studies, which are used in hospitals and research centers around the world. So in our practice, we don't use generic supplements. So what I mean by that is like going back to using the example of ibuprofen. When we get over-the-counter or prescription drugs, synthetic molecules can be patented. So ibuprofen is a molecule that regardless of the brand name, whether it's Motrin or Advil, ibuprofen, which is that molecule, is the same. That's why we buy generics, because it's cheaper. I don't need to buy the brand name. I want to get something that's the same, but just doesn't have the fancy marketing, right? So most of us do that. But when it comes to supplements, it's the complete opposite. You cannot patent a natural product. You can grow turmeric, you can grow green tea, you can grow blueberries and strawberries and bilberries and acai berries and bananas or whatever. You can grow them in your yard. So we cannot patent a natural product, but we can patent how certain compounds are extracted, the processes of how those are taken out of those plants or vegetables or products. And then that can limit how other people do that. So the misconception right now in the market is that there's a lot of products that are great, that actually have studies that are patented, and the companies put a lot of R&D in, and we actually go all the way to clinical trials. But once it's been proven, then the industry looks at, well, let me just take a generic. But that doesn't work because the patent has blocked them for extracting those processes. But the consumer doesn't know that. So they go, oh, 95% curcuminoids. Isn't that kind of what's in your product? It's completely different. Because when we patent it, we take out 3 specific curcuminoids at a specific ratio, and that's what works. And now independent university studies will show when we take the 4 largest manufacturers of just generic 95% curcumin, for example, in the United States, that sell to every product company that you know of, that if anybody takes a product that says 95% is coming from one of these 4, it has very low inflammatory responses, has very low immunological responses based in comparison to the gold standard, was what we use. So a lot of people, oh, I've taken that. No, you haven't taken the right one, right? So this is where the guidance of what we use. So the second ingredient is Boswellia, which is frankincense. There's 3 parts of the frankincense. There's boswellic acids, or AKBBA, and there's something called polysol. It's a new polysaccharide that we use. And the interesting thing is, it's not just saying, I found a fraction that's important, and let me increase it as much as possible. We actually, well, it took 6 years, because we have to look at, sometimes in pharmaceutical world, we look at how can I strengthen the potency of something, so I give a lot of one thing. But that may not be the right thing. What we have to look is, can we mimic in nature what is the appropriate ratio to get the best response? So initially when we do studies, sometimes we say, let's put everything at 90%. Let's just turn the volume up to 10, right? And in fact, it doesn't have as much inflammatory benefits as we would want. So we kind of up and down the doses in the studies to find the right exact dose that actually has the maximum benefit in vitro and in vivo in the studies. Right? So we actually do that. Most people are like, oh, I heard frankincense is good. Why don't you take essential oils? Essential oils don't have that same component. So a lot of people who are not trained in herbal medicine don't understand there's a difference between a leaf, a stem, the bark, the plant, the root. All these things have different phytochemical phytonutrients. Where you're getting that product makes a difference. But it doesn't matter, because on the supplement, I'll just say this product, right? So that's where we lose the efficacy, potency, and purity, and sometimes the safety by not having that. The third ingredient is ginger. So everybody understands ginger. I love ginger. Ginger's an anti-inflammatory. We like people to eat ginger. It must be organic. All these roots and rhizomes should be organic because they're sprayed heavily with pesticides and herbicides. They're crops. However, when we look at in a product, ginger should have something called gingerols. That's like the curcuminoids of the turmeric. And remember, these are small components. So for example, going back to curcumin is 2 to 5% of turmeric. So it's not the same thing. So a lot of people use this, willy-nilly, like, oh, this is a curcumin extract, this is turmeric extract. They don't know the difference, right? And so when we take these compounds, it takes out of 100 pounds of turmeric that we grow, for example, 2 pounds of curcuminoids can be extracted. Now what we like to do is, same thing with the ginger, we extract the gingerols from that ginger plant. We have 20% gingerols right now, which is the highest percentage worldwide. Most companies put in about 5%. Most companies don't put in any. It's just ginger powder. If you have a product that says ginger extract or ginger powder, I just say, just go chop some ginger up and have some ginger tea, have some, spicy food, make good, say Thai food, for example, or Indian food. You don't need to take a supplement for that. That's the redundancy that we're trying to remove. And then when we give something, we want to give it as a targeted therapy. The last ingredient is called bioprine. It's a patented form of black pepper. Like the curcumin, generic black pepper does not have the same effects. It's how we extract those piperine compounds that gives it the best absorption. In fact, Curcumin C3 Complex gets a 2,000% absorption with bioprine. But other companies that use black pepper can't use that claim because they haven't studied it. And now that we actually look at the data, it shows that it doesn't do that to that level. So more importantly is looking at the concept of synergy. Synergy means that when we look at each of the ingredients, now it's combining them in specific ratios so that we can get the best maximum amount. So it's not putting a lot of one thing or a little bit of one thing. It's like we had to do studies. We're looking at how much of each of these ingredients, and Ayurvedic medicine and Chinese medicine is good at that because they understand formulation, they understand balance. When we put formulas together, that means we can take a product for a long period of time because we're also balancing some of the other side effects that can be taken even with herbs over long periods of time. right? Or the tolerance where it just runs out of its efficacy. So a lot of people are like, I take grams of this one product, you know. In the beginning, they might get better, but after a period of time, it wears off. Because that's where, when you understand herbal medicine and other traditional medicines, we look at how do we balance that effect so it's more efficacious for long-term use. Now, with Boswellia, the key is also delivery. So we've been able to put into a bilayered sustained-release caplet. What that means is that it has a fat-soluble and water-soluble component. So someone takes the product within 20 minutes onset of action. So a lot of people are like, oh, I take a fast tab, my acetaminophen, my Tylenol, or my ibuprofen, I have a fast tab, or my leave a fast tab. So we've been able to design it so now you can have that fast-acting action, and then we have a sustained release so it lasts over 8 hours. You know, a lot of people say, particularly cancer patients, they'll read studies on curcumin, even Curcumin C3 Complex, and there'll be studies published, oh, someone took 8 grams a day. Help them with their cancer, for example. And they had to take 2 grams and 2 grams and 2 grams, and you know, and it goes in the blood and it goes down, and it goes in the blood and it goes down. What we're trying to do now is what is the minimum amount that we need to get the maximum benefit. So when we sustain release it, it goes in the blood, and then it has this peak, and then it just maintains, right? So we're looking at how do we use it more effectively. Lastly, why we bilayer it in a tablet is because almost 90% of the products in the market, we're the only one that has the bilayered product actually, put it in capsules. So if you put turmeric and you put Boswellia, you put ginger and black pepper in a capsule, or you put bromelain or papain or any kind of proteolytic enzyme, nattokinase, which you'll see all these products. Even there's copycats on Amazon right now that look at our product, let's put it in a capsule and sell something, you know, generic of it, but let's just sell it really cheaply, is that those ingredients actually degrade each other as it sits in the capsule. So there's a science to manufacturing, there's a science to the art of medicine of how we put herbs together. So when someone makes this capsule, you know, it's say in New Jersey, New York in a factory, and then, you know, it takes about 3 months to leave the factory, then it goes into distribution, and then it goes on a truck, and then eventually they go to like a health store to go buy it. It could be 9 months, 12 months by the time that the client actually gets it. There's already a potency that's just degrading as it sits on the shelf. So ours is like a medicine. When we look at nutraceuticals, and that's my specialty, how we formulate, it's like, how do I give you 100% of what you take at the time that you take it, when you take it? And that's how we get efficacy, potency, purity, and safety.
In Chapter 9 of Inflammation Nation, what did you mean by Step 7, increase immune system functioning?
So keeping your immune system strong is key. So as I mentioned, whole food plant-based diet, right? Get your antioxidants, your phytonutrients, your fiber, your anti-inflammatory protein. Lowering the inflammation with Boswellia SR, for example. But then moving and keeping your immune system strong is one of the most important factors, because we are not taught in Western medicine the word strengthening your immune system. You know, Western medicine is really good at one thing, something called suppression of your immune system. So if someone has an autoimmune disease, we suppress that system. We give steroids, we give biologics that are destroying or lowering the immune system response, so the patient has a relief immediately, but then they have an onset of other side effects because you need your immune system to fight against a virus, a cold, or someone sneezes on you, you can get a pneumonia. Okay? So we need some part of the immune system. Now, Eastern medicine is really good at that. Indigenous medicines are really good because they've understood this for millennia. The concept of there is certain herbs, there is certain products that people can take naturally in their environment or in a supplement that will help increase their natural killer cell function, that help their immune system function, that keeps them from getting sick. There are tonics out there. There's also specific specified products. So when we look at products that have what they call beta-glucans is a polysaccharide, usually comes in mushrooms, oats, and barley. So as you can see in Chinese medicine, Japanese medicine, lots of mushrooms, right? You go to the store, mushroom extracts. And all the mushrooms have a beta-glucan. And so we recommend all our patients to eat as much mushrooms. I think Dr. Furman talks about, you know, G-bombs and M is his mushrooms. So, you know, eat more mushrooms, yes. Sometimes people have an allergy to mushrooms, so then we have an alternative for that. But the polysaccharides in mushrooms are only about 20%. So no matter what product, when now we're talking about products now, it's only 20% that they can actually extract the polysaccharide. And some companies can get to a maximum of 40%, but there's a patented form that has been able to take a minimum off a culture, actually it's like a probiotic species, of 83% or more of beta-1,3-D-glucan. And why that's important, because now we've done in vitro and in vivo studies independently at universities where they do comparison trials. So they look at the cell culture and they look at the animal and they look at which of these products that come from mushrooms, these beta-glucans from any source, rice bran, oats, and more importantly mushrooms, they looked at about 50 plus different products on the market, and they actually tested which one is more potent, which one is stronger, and the Glucan 300 is what we recommend to our patients is the strongest. Now, it doesn't mean that any of the other mushrooms don't work. We just want to look at, well, which is the better one? because I don't want redundancy. A lot of patients come in and they're taking like 6 or 7 things for their immune system in the mushroom family. I'm like, no, here, just take this glucan 300, eat mushrooms, and now let's get something else that's coming from a different pathway and stimulating your immune system. To further continue on the immune system is simple things like vitamin D, right? That's the simplest thing that people can take, right? And you should have your vitamin D checked from your primary care or your other healthcare practitioners. And we want to get a targeted range between 50 and 100. When people get to between 50 and 100 on that test, there's about a 60% reduction in the chronicity of disease. So it's a simple biomarker that shows, is your immune system good or is it kind of low? And it's not specific, doesn't tell you who, what, where. It's kind of like, did the Pentagon get $762 billion of our money? Yes. Hopefully they spend it correctly to keep us safe. Right? So the idea that we see then in the literature is that when that vitamin D level is in this targeted range, then whatever disease, whether it's Alzheimer's disease, whether it's mood disorder, whether it's IBS, whether it's arthritis, it gets better and it helps preventing it getting worse, because when your immune system is stronger, your military, your Army, Navy, Air Force, Marines, which I call your immune system, they're able to fight, fix, and defend better. And that's all we're trying to do, is always repair and defend, repair and defend, repair and defend, fight and defend. Our whole body, from viruses, from bacteria, from cancer, from injuries. And so when we do that correctly, then your response is better. And vitamin D, again, is something so simple, so inexpensive. Now, can people get it from the sunshine? Absolutely. But most of the time when we test people, we're still not getting as much sun as we should. Even in the Southwest, we get, people are like, oh, I live in Arizona. I live in New Mexico. It's the desert. We should have higher levels. No. And in fact, people with darker skin, so for example, Latinos and Mexicans and Spanish people and African Americans and East Indians, for example, we have the lowest, because the darker our skin, the lower our vitamin D levels, because we don't get melanoma, right? With the protection of our pigment is that it prevents us from getting skin cancer. But on the flip side, though, it also lowers our absorption of vitamin D. So we should test everybody, and we still recommend everybody to probably take a little bit of vitamin D, especially if they're lower on the range.
What do you recommend for people to take when they have a flu or a cold or upper respiratory infection or urinary tract infection? Are there any safe alternatives to antibiotics that work just as well?
Yes, so there's a whole armamentarium of herbal medicine that we give specifically. Some of them are more for bacterial infections. Some of them target more urinary tract infections. Some of them are more, skin infections. Variety of aspects. And this is where herbal medicine is key, because I heard yesterday, they kind of threw out a couple of herbs and they said, well, just take this. And that's good, but we like to get, again, a little bit more targeted, because there's other aspects where, again, those herbs can dysfunction the microbiome. And some herbs have better penetration on different species of bacteria. Some of them are better antivirals. Some of them are better antifungals. And so there's an aspect of education, I would say, on herbal medicine. A lot of people are like, oh, herb's anti-something. Well, there's rankings of those. So we like to look at that in our clinic of if it's this kind of infection, then this is the type of herb that's been shown best in the clinical studies and through traditional use in practice in clinical medicines in cultures around the world. Now, sometimes if it's broad spectrum, so sometimes I got a flu or a cold, like I'm here at this conference and there's all these people coming in, we're flying in and people from all over from the airport and all, then I use something that's kind of a broad spectrum if I think I'm going to get sick, only the times that I travel, or if I do get sick, and that's called a coated silver. It's a nanoparticleized colloidal silver that's actually a nanoparticle, and it's actually colloidal. A lot of the products in the market you'll hear is oh, I take colloidal silver, I have something that's 11 parts per million over the counter, 23 parts per million. We look at something that's 20,000 parts per million, and it's a nanoparticle. They have studies on it, and that's been patented. And the interesting thing, the studies have been actually done through Department of Defense, through sort of research and funding, and we look at it at having strong antiviral effects, even against Ebola and Marburg virus. So these are things that are very serious infections that we hope we never get in the United States, but we have to look at, can we take something that can have this broad spectrum? Now, it does kill bacteria, it does kill viruses, but the benefit and the detriment of using some of these products is that most people don't realize that when they take over-the-counter what they think is colloidal silver, it's actually ionic silver. We've done studies, or there's people who have done studies that we've actually worked with and looked at the research, where some of the products even that I was using, that I was sold at medical conferences and used for years, is not exactly what they proclaim, right? And so it's kind of like, what do you mean? You gave me all this information. It's like, you got to have third-party verification. And so we go through looking at who's the expert in these fields. And when they actually, again, doing comparison studies of all the different silver products in the market, most of them don't even fall into that colloidal range. Second of all, is that a lot of them what they call bioaccumulate. So it actually stays in the tissue. With the coated silver, interesting thing is that we actually can see that it's been excreted out in the urine. So we're not accumulating these molecules. And the other thing is that there's studies right now with the coated silver, which is nice. In culture, it shows that it does not affect the microbiome negatively. So if people do have to take it for a little bit longer time, say they have a chronic viral infection, right? They have a hepatitis or a Lyme's disease of an infection, something that we'd have to take something for a little bit longer than just a 3 or 5 or 7 day kind of thing. Now, I don't like to take any of these products preventatively. I think that's a malpractice, and I think that's a misuse. A lot of people will argue and they'll sell products or endorse products like, take silver every day to prevent something. I go, no, that's kind of, again, overusing something and misusing it. They're not understanding the science of the microbiome, especially with the other products in the market. But even when we give it for a targeted, 3 days, 5 days, 7 days. I'll just give you an example. I had a patient the other day, she had to go for hip surgery replacement, and she had a multi-drug resistant urinary tract infection. So she's seeing infectious disease. They're giving her all these antibiotics, and it just doesn't kill it. Because she's taken, she's had infections before, so they keep on giving it, everything's getting resistant. We put her on there, 3 days later, it's gone on urinary, on culture. So it's just one of those things that we want to keep these things also in reserve. So right now, with this chronic aspect of even maybe epidemics or pandemics in the future, these are things I recommend people just to keep in their medicine chest as, if I need it, I can use it, but I don't use it preventatively. I like to use it like, if I think I'm going to travel, I take one of these, it's 1 drop a day, the day I travel, the day I come back. Or if someone gets sick, 3 or 5 or 7 days. If someone's not better by day 5, I'm like, then you should go see your healthcare provider. We might have to pull out a prescription, or we might have to do a physical exam, or we might have to listen to your lungs. Most of these things that we like to do is we like to teach our patients self-care, so that most people should be able to take care of almost 90% of their health problems at home, right? My job is just to further define that. If there's an issue, then we go further to the next step.
Do you recommend antibiotics for sinus infections?
In general, no. If someone's actually physically my patient, what we do is we like to look at using a nasal wash. It's actually, it's funny, it's called Dr. Pai's famous nasal wash by the pharmacy, compounding pharmacy. Because we looked at is, in most other countries like India, we use, neti pot, for example. And then it's looking at, how can we use Western medicine and using an Eastern practice. So we put like an antibiotic, a broad spectrum, we put an antifungal, because sometimes sinus infections are actually fungal, not bacterial. That's why they don't respond to the antibiotics. We put a little bit of a mild steroid, and we put a little bit of xylitol in there. That helps keep the mucus really slippery. You see xylitol like in natural toothpaste and natural mouthwashes and nasal sprays. And so it's a nasal wash because we want to use the medicine appropriately. But if someone has an infection here in their sinus, why would I want to give them, say, amoxicillin orally, which now knocks out their microbiome up to 18 months later, for example? But also, that antibiotic goes head to toe. Remember, when we write an antibiotic, and we say, here, hey, Ben, here's your prescription for zithromycin or amoxicillin. We're not saying, we don't write on the prescription where to go, your left ear, your right upper lobe, or your bladder. We give it to you, and that molecule goes into the system, and it hits every single cell. And that's why when someone has a side effect or reaction to an antibiotic, or any kind of drug for that matter, or any supplement for that matter, these things go head to toe. They don't just go to the infection, right? So they go all around the body, and if there's that bacteria, luckily it kills it. But there's also areas that you're also getting side effects. Like your toes don't need more antibiotic, your liver doesn't need more antibiotic, and your microbiome doesn't need more antibiotic. The area that needs the infection is where the antibiotic should go. So we like to give, again, this is where integratively we're using the best of both worlds. How can we give a direct Western medication safely and more effectively using an Eastern delivery system?
In Chapter 10 of Inflammation Nation, what did you mean by Step 8, maintain healthy glucose levels and avoid excess sugar and salt?
Maintaining a healthy glucose level is one of the most important things, because right now in America, blood sugar problems is basically running rampant. We see what they call insulin resistance for a long time. This is the area where the blood sugars just starts to teeter to get a little bit above normal, but it's not diabetes yet. So there's this range, but we always want people to be normal. Okay? Even when someone's diabetic and they go, oh, I'm taking medications, and they're saying I'm under control, and they're still over here, but they're under control. You're not under control or normal until you're normal. Right? So there's a little bit of a misnomer. Now, why that's so important? Because blood sugar problems is the first domino effect of many diseases. Okay? So when the blood sugar starts to tip, then that excess glucose is pro-inflammatory in the body. So we understand now that excess sugar in the diet, also refined carbohydrates and all these other things, and GMO sugars and high fructose corn syrups and all these other things, we just eat such a high sugar diet, that's a pro-inflammatory food. So when people have blood sugar problems, insulin resistance, diabetes, for example, they have more inflammatory problems. They have 4 times more heart disease, right? that blood sugar, when it's elevated, does two things. It also converts to lipids, so they have more cholesterol problems, right? That blood sugar then adds them not losing, or maintaining weight, so they start gaining weight. It increases blood pressure. So then all of a sudden, here's a drug for this, here's a drug for that, and so they might go see multiple doctors, not looking at if you get this first domino under control, then usually these 4 or 5 or 6 or even 10 other problems that can come down the pipeline. Even aspects that are metabolic, like cancer. Cancer is a metabolic condition. Cancer has metabolomics, where we understand that cancer cells have 10 to 12 more times insulin receptors. So sugar actually feeds cancer, right? In a way that it uptakes it more than a normal cell. When we do PET scans, that's how we do a PET scan. We fast the patient, we give them a little glucose with a radioactive tracer, and then the cancer cell will pull up the glucose so that we know since it's more metabolically active, then we know where cancer is. So a lot of people want to quote unquote starve out the cancer. What we want to do is just get your body into its normal function, right? So if someone has diabetes and they have cancer, their cancer is more prone to grow faster or have a more serious stage of disease by the time it is diagnosed, because the environment of it is conducive for that growth, right? So we have to look at everything, but blood sugar is super, super important. And we like to look at, there's a lot of natural therapies instead of using drugs that can do it. Lifestyle can do it just as well. Within 30 days, most people, if they want to do a whole food plant-based diet correctly, we look at what foods are causing inflammation, we look at fixing the microbiome, lowering the inflammation, increasing the immune system. Most people within 30 days can, even Dr. Cousins here has done that and has proven that many times. So just like we can reverse heart disease, we can reverse diabetes. Even type 1 diabetics, believe it or not, a majority of those patients can still get off of insulin. If not, they can reduce their insulin about 70 to 90%. So these are things that, we have people who are, since the age of 6, have been giving them insulin injections, and they're like 40 years old. They're saying, no one's ever told me I can get off of this. And said, well, let's challenge, the body has an innate ability to heal. You just need to give all the tools and measures around it to support that function. And so if we do that, people are like, oh my God, I'm off my insulin. Or I take 90% less insulin, which is still a preventative benefit for that patient. So glucose reduction is very, very key in all ages. And now, more importantly, we're looking at what they call type 3 diabetes, which is this chronic inflammation into the brain. And this is one of the triggers that we're looking at: early Alzheimer's disease, Parkinson's disease. These are just another, aside of just inflammatory foods, the blood sugar being slightly elevated or elevated also triggers these chronic changes. So again, from all sorts of factors, lowering your blood sugar is better.
In Chapter 11 of Inflammation Nation, what did you mean by Step 9, stress reduction through meditation and yoga? Are there differences in yoga practices, such as hot yoga?
Let's start with yoga first. Okay, so yoga is important because there's a lot of misunderstanding. My book will kind of go through this in general, but we have a lot of data. And in India, there's actually research centers, where yoga derived from or comes from. And it's actually a true practice. The false narrative, again, that's getting sold is that a lot of people, I'm a yoga instructor, they took a little course. There's companies that make money just giving licenses. But it's a true practice that you have to understand that it's a division of Ayurveda, which is the science and knowledge of life, right? It's the traditional medicine of India. So it's actually a practice. People get masters and PhDs, and we do research studies. So we have specific asanas, which are postures. We have pranayama, breathing techniques, and even mantras and meditations that actually have been designed and studied to be reversing disease. So there's certain yoga that will reverse heart disease, diabetes, depression. Here we think of it as an exercise. People go, oh, I went for my spin class or my cardio, I did some yoga. That's not true yoga. Now, it's still helpful, but that's not the true practice, because yoga is actually preparation for meditation. So a lot of people miss this aspect because it's actually not just strengthening your body and improving flexibility and improving your immune system and lowering your blood sugar, increasing your bone density, all the stuff that will be studied and explained in my book and how it can prevent these things. But more importantly, it's the practice of preparing the body to be going into this meditative state. It's putting you in the parasympathetic kind of relaxative state. Being more in the alpha and theta state in meditation is key. Having the heart rate variability, which is what we call coherence of your heart, and that also has the coherence of the brain, has been shown that people that have diabetes or heart disease and even cancer, they live the longest, because it's about how do you decrease your stress. 20 minutes twice a day is what we recommend. If you can do more, even better. A lot of the people here on the panel, and they'll talk about some of them doing an hour a day, and they're like, wow, and they look super young and they're super healthy. All the data shows that, and you can go refer to those videos of like how the data on just meditation can actually help reverse aging. So it is something that's very simple. Now, meditation also doesn't need to be specific. It can be very general. So we use mantras. We like to give specific because that's a kind of a tried and true thing. But some people use mindfulness. Some people actually don't call it mindfulness. It should be mindlessness because we shouldn't be thinking of things. But if you want to just use guided imagery or listen to music, there's not a correct or right or wrong way to meditate. The problem is most people don't do whatever they're supposed to do. Right? So that when we use something like a mantra, that's sometimes a road that's already been traveled. So sometimes it makes it easier and more specific for the patient to get there. However, now there's even devices, which I like, because I like to use technology. Most people need biofeedback. So there's devices that they can put on their head, or devices now we can put and measure heart rate variability that we can see, are you in that zone? Are you doing meditation right? A lot of people are like, well, I don't know. How do I know? Right? And so now there's validated scientific tools that can say, is your brain waves, is your heart waves in that coherent state? And then therefore, if it is, you're getting the maximum of benefits. And in fact, if we got those benefits in a pill, that would be a blockbuster. Like that's how important those practices are. And those are ancient techniques. We have to be careful though with yoga and some of these meditative practices now. People are selling like hot yoga, which is a pro-inflammatory state. Right? So people have this artificial flexibility due to the heat, and they have more microtendon and tears and injury doing that than any other type of yoga, because that was basically created for the Western market. That wasn't a traditional actual practice, right? But these are things that, goat yoga, beer yoga, you see all this over Facebook. It's quite insulting for me because it's like they're taking something that's a true medical practice and then making it something as, spinning it out as that someone can put it in a yoga studio or charge a monthly membership for. So we have to look at, if you do that correctly, and we actually teach yoga. We actually have a yoga studio in our integrative practice, so we have classes. And anybody can come, and anybody at any skill, because a lot of people are afraid to do these things because they say, oh, I see these magazines and someone's like in some kind of twisted pretzel pose. It's like, it's doing the practice and then getting into that meditative state. That's the key, that you'll get the full benefits. Even the rest between the postures is where the data shows. So a lot of people want to do things quick. That's a Western concept on an Eastern practice that's used inappropriately. So when we give yoga, we actually prescribe it. We actually will do specific therapy. So Maureen, our instructor, my partner, she will teach like certain pranayama techniques, certain meditations for the patient's condition. So it's not just like, oh, I go there and I just do some simple thing. There is some general things you can do, but there's also some specific targeted things. So again, we're always moving it to the medical level because all these things are medical practices. Unfortunately, most of the therapists and practitioners that provide it don't have the education or full training, so then it becomes this kind of fancy marketing tool.
In Chapter 12 of Inflammation Nation, what did you mean by Step 10, love, happiness, social relationships, faith, and spiritual practices?
That's so important. All of those, by the way. John Lennon says, all you need is love, right? And so it's really key. We have to understand that what we understand is epigenetics is what we need to do with all our patients. That's the diet, the lifestyle, the environment, and then lastly is their belief system and community. And so genes are not fixed, they're in flux, okay? So heart disease does not run in a family. We used to think, oh, my grandfather, my dad, my uncle, my brother had a heart attack, so heart disease runs in my family. That's not necessarily true. What's happening is that the likelihood of those genes, you've been dealt that card, it's how you play that card is important. And so it's called the epigenetics. The diet, the lifestyle, environment, belief system is the same because you were taught the same thing from your dad, you were taught from the ground. You eat the same food, you grow the same disease. Okay? And in my lecture I talk about, in my book, I get into the detail where 97% of disease, chronic disease and cancer, is preventable. Only 2 to 3% of disease is genetically related. Everybody's so worried about their genes. I'm like, what can you do right now with the diet? Diet's number one, tobacco, getting the obesity down, getting the infections in the immune system stronger, and cleaning up the environment. So those are things that people right now can do every day to do that. But in order to actually transform, people need to have community. Right? So we understand this word called tribe. In our practice, especially with our cancer patients, we move cancer patients from a area or a position where they're used to be thinking of themselves as a cancer survivor, and we transition them to a cancer thriver. You can't just survive. Anybody can survive. We're Americans. We survive everything. Hurricanes and gun shootings and, all these kind of calamities, even elections. We can survive these things. But the idea is that it's getting the body to be stronger than it was before. And so you have to thrive, not just survive. And we help change the terrain of the individual. But how you change that terrain is not just the foods, it's not just the anti-inflammatory agents, it's not just the immune supportive agents, it's having that community. The data will show that when people have tribe, when people have a group of people that help them, who are supportive, not judgmental in their, coming to this conference, there's a bunch of tribe now. People are bonding with each other, like, hey, I started to change my diet, but I need a little help here, and everybody else thinks I'm kind of crazy in my family. But you need to have that support. The data shows that those people that have that community tribe live the longest. Living with a sense of purpose, you live the longest. In every single study with cancer, they live 15 years longer, women who just had support group. If we had a drug that gives you 30 days more in the ICU, again, blockbuster, and here's something, you just meet in a room and talk, or just on social media, we can get this. Now, we don't want pity party, you need support. But having that support of purpose, those people who survive the longest can see themselves in the future. Having a sense of service, charity, doesn't mean giving away things, but it just means like helping other people, even helping other people with your condition, in the same situation, right? You can share those experiences. But community, love, coexisting is really important, and that's the part that I think at the end of the day, most of the medicines are missing, right? Because we're just biochemically, pharmaceutically, I'm fixing your microbiome, I'm fixing your immune system, I'm fixing this. But the body's immune system and the body itself you're the conductor, you're the general, and you have to give direction. But if you're lonely, if you don't love yourself, if you don't love others, then you can't give the right, proper direction. So a lot of people can take all the steps, but if they don't do step 10, which is very interesting, and in fact, it was the shortest chapter in my book, because by the time I got there, I was getting tired of writing, actually. But on the revision and what I'm working on, that's going to be the data is just immense. And I can't say just from my experiences now over the last couple of years how important that is. And sometimes I start with my patient, we start with that because the rest is super easy. If something's motivated, you'll take the right things, we'll take the right foods, we'll give you the right supplements, or the medications if you need, we'll help you with side effects or whatever it is that we'll get you through. But this is the thing that we need to work on, is having community. And in our clinic in San Giovanni, we're trying to build, and what we do is we build community. So we have community events. We bring in local lecturers. We bring in other traditional healers, because people need to understand there's a vast array of other integrative and natural practices that we've never even heard of sometimes. And this is what's been tried and tested and true for thousands of years. So bringing back that community, and if you look at every indigenous culture, from like the Native Americans and to even in India, there's a part of having that community that those people who survive, even the people in the blue zones, the people who live the longest, one of their main staples is community. So we have to look at when people survive the most. The problem is right now we are being disconnected with social media. Even though people have 1 million followers, they don't really communicate. Right? Kids sit behind a table at school and they're texting each other just right across the table. They're not communicating. They're not actually feeling connected. We have likes and dislikes, but we're not actually feeling that we have community. So the goal is really to kind of disconnect sometimes, I say, and then kind of get out there in the world and develop community. Some people are developing community for their food, they're working farms and vegetables, and this is like some people are helping people just with service. And so the idea is that community is super important, and if you do that, then all the things that we give from steps 1 through 9 actually become fully implemented, and you get the full benefits.
In chapter 13 of Inflammation Nation, what did you mean by summary, moving forward and taking action?
So in my book, I use a lot of quotes, and a lot of people know me as the rock doc. I play guitar, I play drums. I use a lot of musical quotes in my book to make it some enlightening, to show some of my personality, and also sometimes it helps people remember things. And so I have a quote from Rush, which is I will choose a path that's clear, I will choose free will. We need to understand that we need to be making the right decision. When patients see me, I use a lot of analogies in my book to make it easy for people to read. I take complex ideas and make it very simple. If people have ever watched the movie The Matrix, it's kind of like Morpheus who's sitting to Neo, and he gives him the opportunity. You can either take the red pill or the blue pill, right? The blue pills, you can swallow the blue pill, and you can kind of go back in the world of ignorance and just kind of go on with life and think that's the drone, being the ant in the anthill of life kind of thing. Or you can take the red pill, and you can understand some of these inconvenient, hidden, sometimes uncomfortable truths that we live in. But then it opens your mind for understanding, better choice, reasoning, and consciousness, then will lead you to liberation. And that's liberation of disease. It's liberation of getting stuck in debt. It's liberation of being the slave in this capitalistic system sometimes that people can't get out of. That's what we're trying to fight for, right? Universal health care or some kind of thing, or maybe less college debt. So the idea is that when I say moving forward is because after people read my book, the next step is to really take action. Right? And they have to move forward. So the goal is you can get all this knowledge, but if you don't take the first step, nothing's going to change. And the way I come from my perspective is I'm a little bit more with radical change, because we can't just do small increments anymore. I mean, we've been doing that for decades. Whether it's policy or politics or environment or food, we have to make drastic changes if you want to have drastic results. If you want to say, I want to feel the best, then an Olympic athlete doesn't wake up one day and say, I get a gold medal. They have to practice day in, day in, day out, on and on and on. So a lot of people think, oh, they're naturally with that. Naturally born that way. They're not. They work all day. So health is a practice. I tell people I practice what I preach as much as I can. It's still a practice in motion. Every day I have to do a little bit better. I'm not a purist, I'm a realist. Realistically, we need to make better decisions as often as we can to make sure that we're not getting stuck with all these things that have been marketed us to keep us where we're at, And I like to, in my book, I end my chapter with a quote from a band, which is very interesting, who's coming back this year, called Rage Against the Machine, a very political, active-oriented group. And it says, if it has to start somewhere, it has to start sometime. What better place than here, and what better time than now? That's what I like to end with.
I'd like your opinion on different types of therapies that people use. What's your clinical experience and opinion on A, colonics, B, saunas, C, PEMF devices, D, hyperbaric oxygen chambers, E, ozone therapy, F, fasting, and G, green juicing?
Okay, so I think we spoke about the colonics, but colonics actually create dysfunction into the microbiome. So I don't recommend colonics. Now, in Ayurvedic medicine, we do something called Bastis, which is very different. But in general, I avoid colonics because really it's treating a symptom and not really going to underlying cause. If people move to a whole food plant-based diet again, they're eating 40 grams of fiber, which only comes from plant foods again, they're hydrating very well, they do some kind of exercise, then the body's already detoxifying. Like, we don't have to have a colonic to flush us. So that's something that, again, I think it's more of a Western modern therapy that's kind of, again, something that people can sell. Here's a center, go in and get it. And the more you do that, you get actually hooked on that because it actually causes a drying effect, and then people get constipated. So then we get colonic junkies who end up like, I got to go every week for my colonic. And now we even have data, and we have even some clients who were completely plant-based but were colonic junkies, and they still even get colon cancer from that chronic dysfunction of the microbiome, which people would find, how did that happen? Because they're eating plant-based, anti-inflammatory, but this is a therapy that is not a normal function, right? Again, it's a quick fix. Instead of taking a pill, it's a procedure. So saunas are, I would say, it's in the middle. Can people do saunas? Sure. Do people overdo saunas? All the time. A lot of people think they're going to sweat out their toxins. That's not necessarily true. Usually losing a lot of water weight, And do you sweat? Sweating is good. You want to sweat. You want to, that's why you perspire. But you're not going to get, like, people think, well, I'm going to sweat my cancer out. I'm going to sweat these other things out. Not necessarily. And so I always restrict people on saunas because a lot of people who are sick, they go, oh, I'm going to buy this expensive $5,000, $10,000 thing, put it in my house and sit in it for hours a day. I'm just like, why don't you focus in on getting real good food, get the stress reduction, all the things that we know that are very inexpensive that will actually have data to show that you'll get better. So if someone does have a sauna, I don't mind them using it. What it does is that we're actually trying to increase circulation in the body. Okay, but again, more people like to turn it up to 10 and sit in there for hours and feel like it's going to sweat it all out or kind of beat it out of themselves. You don't need to do that. And so using a sauna maybe a small amount of time per day could be beneficial, but there's other devices and other things out there that are more effective. So pulse electromagnetic frequency, that's an area of one of my specialties where actually we published one of the studies with the device that has been used in clinical studies that have been used in Europe that actually is a patented form of a pulse electromagnetic device. Remember, we think of EMFs as bad things, right? Like 5Gs and stuff like this. PMEFs is a pulsed electromagnetic frequency that is pulsed at a specific rate. But some companies have actually patented a specific signal that it can increase the microcirculation of your capillary flow. So what happens is, we have arteries and veins, and then we have arterioles and venules, and we have these capillaries. There's no drug that affects this basically 76% of circulation in your body. That's why massage is important. That's why yoga is important. That's why stretching is important and exercise, because you're trying to move circulation. When we go see a cardiologist, that 14% is your carotid, your pulse. We take your blood. That's 14% of circulation. We have drugs that can affect that main freeways. But all the little roads in your body, which is everywhere, 76%, nothing, no drug or herb does that. So technology can be used because now we have studies that are patented now and the technology that will move that circulation. So if someone has an injury, what happens is the microcirculation due to inflammation, scarring, tissue, and damage can't flow. So even if they take the right herbs or the right drugs or the right food, it's all about delivery. Healing is about delivery, and that's why when people are sick, we want them to move. When people have surgery afterwards, we want them to move, because the more you move slowly, it's about circulation brings the nutrients, that takes the drugs, it brings in the oxygen, takes out the toxins, also moves the immune system to where it needs to go. So now, the issues with PMEF devices, that there's a lot of devices out there that claim to do things, and this is what the market is, like we can get something and sell it on the market. And we have to look at, is there data to show that? And so when we actually compare studies, and these are governmental studies now that have been done, most of these other products, as soon as you turn it off, it's done. So are they helpful? Yeah, you're on the mat, you're on this, the device, you can get the benefit, but the ones that are more clinically effective is that when you're on the device, it will last 12 to 24 hours after you're done with the therapy. So you have these long-term benefits. And we use these things for patients that have chronic pain, so back pain and body pain, increasing the circulation to a place that needs to be healed from a fracture or post-surgery, to even athletes. So we look at professional athletes, they want to recover faster. So how do I get that? Now there's sports teams that use these things now to enhance their performance, because you're building up lactic acid when you're racing a bike, or you're on the football field. When you get off during the break, you can lay on the mat, increase the circulation, get the oxygen and lactic acid out. It's not doping, it's not a drug, it's enhancing your normal physiological function. So there's a difference between PMEF devices, and we look at using the best ones.
Next was hyperbaric oxygen chambers.
Very expensive. A lot of people get this, particularly cancer patients, unfortunately. Can it be helpful for healing wounds? Yes. That's why most university centers have it. Like you have an ulcer, a wound, a diabetics thing, it helps with oxygenation. Do you get a little bit of a boost of oxygen? Yes. Could you use a PMEF device to get that without the expensive oxygen hyperbaric chamber? Yes. It is, in my opinion, just a little bit out of touch because it's so expensive. So again, someone's going to drop $10,000, $15,000, $20,000 on a hyperbaric chamber. Can it give them benefits? Yes, but again, is that money spent wise? I'm not against hyperbaric chambers, but you have to have a place for people who know how to actually control it. We've seen clinics where they turn over people in hyperbaric chambers and they're not adjusting pressure, which is very discomforting and actually can cause dysfunction in the body. But sometimes, it's just like, here, let's turn it in, and sometimes they're old, they don't regulate the pressure correctly, so it can be used effectively, but I think it's again, that's something that's down the line, that I have other things or other aspects or even therapies that I would give first line that would give a bigger bang for buck.
Next was ozone therapy.
Ozone therapy. So ozone therapy we've seen have certain limitations. It can be important for what I've seen clinically is that if people have chronic viral issues, we've seen some data and we see some clinical aspect where that's been helpful, ozone, but it has to be very carefully used. There's a lot of practitioners, particularly in certain states like mine, where through other licenses, through other means, that here's an acupuncturist giving IV therapies, for example, and that's not their field of expertise, but they can do it anyways. The biggest challenge that we have is a lot of patients now want IV therapies. That's the big trend in America. IV vitamins, IV ozone, IV, and it's not restoring their function. It's looking at how do I get, again, the quick fix. It's like the colonic now by IV, right? So we have to be careful because, you can actually cause harm. It can actually, so they say, oh, it kills this, but it also can kill other things. And so I would limit that to really, really highly specialized functions with people who actually do that as their specialty only, not a clinic that, oh, that's one of 50,000 things that we do, because it is something that has to be monitored very carefully. And then most of these products have not been actually regulated correctly. So these are like, we call the gray zone of alternative medicine, where even if an MD is doing it, it's not actually, it's kind of an off-label use. It's kind of like you sign the waiver, and I get a little bit nervous or kind of, I stand a little bit cautious, because we do know that sometimes people can get certain type of injections from orthopedics. It can be very helpful, right? So an orthopedic doctor might be using it, or some people for pain management can be helpful, but it's still not getting to the underlying cause of why they have those problems.
Next was fasting.
I like fasting. I mean, the fasting has been tried and true. It's been around for millennia. As much as we ever found food, we also fasted. Most of the cultures have a fasting part of their ritual in their culture. So in America, why we don't have fasting is because it's all about serving you food 24/7. So even for example, when Lent comes, they still want to sell you the other food, right? At the fast food. so it's like, because we don't want you to stop eating or drinking. That would probably crash the economy in certain levels. So it's very interesting because most cultures, they do have some kind of aspect of, well, let me fast during this part of the year, or even for a month, for example, or different holidays. Fasting is a really good way to help really calm the system down. There is very strong data now with cancer patients, for example, and fasting, 3 days or 2-3 days prior to their chemotherapy actually helps reduce, and then 2 days into the chemotherapy has been shown to reduce the risk of the side effects and improve their outcome of the condition, because all you're doing is lowering the overall glucose intake from all foods, right? And the studies will show that eating a whole food plant-based diet on a lower caloric restriction during those days is the best. Again, we don't want to be doing ketogenic, we don't want to do paleo, but eating a whole food plant-based diet, because you still need the phytonutrients, the antioxidants, and the anti-inflammatory protein and the fiber to keep the person going. But fasting is super important. Now the problem is a lot of people overdo it. So fasting is something that you kind of work into. So I always tell people when they start fasting, just do it for an extra hour longer, that you're not eating in 2 hours, 3 hours, 6 hours. You got to get. But a lot of people want to go right to like a water fast or something. They go crazy, right? It's like you don't just run a race, you train for it. So same thing, you have to slowly build into the body, gets that physiological changes. I don't really have to have people do water fasting. I think people who do water fasting should be medically supervised, because when people just water fast, especially if they're taking medications, certain medications they have to either reduce because it can actually cause more side effects because they're getting less food in the body and less nutrition and effects of absorption. So I like kind of doing like a juice fast where they're having a little bit of green juice, so there's some sustenance. Again, a lot of people want to just starve themselves out of it, and that's a little bit too much of the mentality of like too much too far. If you do it correctly, like a practice, like I think Dr. Cousins talks about, he does it twice a year or something, like that should be like a normal practice of the cleanse. In Ayurvedic medicine, we do what they call panchakarma. That detoxification is like every season change, or at least once a year. It's like, how do we go through this practice of clearing out? So fasting is an easy way. Again, it's cheap, it's free, it doesn't cost anything, but I think people need to have guidance. In our website, we do have House of Sanjeevani YouTube channel, and we actually have episodes. In one of the episodes, we talked to Dr. Clapper, who's one of the world's experts in fasting, and we have a great discussion because really, at the end of the day, fasting is like a great intervention, but if people truly eat a whole food plant-based diet as much as they can, then fasting may not be needed. But really, due to our sad American diet and our lifestyle, fasting can have an important role.
And green juicing.
Green juicing, again, too overly simplified, right? So what's in the green juice? Is it fully nutritionally sound? Again, most of them aren't. They put a couple of fruits or vegetables and they sell it. Can it be helpful for your health? Is it better than a soda or a standard American diet food? Absolutely. Is it going to truly do what people think of like detoxification? Absolutely not, because they have not been designed. Now we use protocols again that have designed what should you put into, if you were doing juicing, so that you get all the phytonutrients, all the anti-inflammatory proteins, the antioxidants and the fiber at the right amount. So it can be done as a meal replacement. Right now, since most of these products or programs are nutritionally not up to par, then that patient actually ends up having deficiencies. So they get fatigued, they get tired. They think they're detoxing. Oh, it's a good thing. It's like, no, you're nutrient deficient now, because they're not been designed by people who have studied nutrition. These are online marketers.
What do you recommend for people fighting cancer?
So I recommend for cancer patients to read my book. But really what they want to do is, read my book. That's a good thing. And there's videos online. And we, even if they listen to our YouTube videos, we have about 28 right now on a podcast, video cast. It's because you need to get all the information, right? There's not just one thing to do. And so the problem with cancer patients right now is that they're all running from the conventional system to the alternative system. But we have to be looking at outcomes data. So although they're understandably, I can understand why people want to not have chemo or not have surgery or not have radiation. Obviously, for all the reasons, right? It seems a little scary, it's a little invasive. We all had patients or people or family members who've had bad outcomes sometimes. However, we have to apply that same criteria of, okay, how are these people doing, also compared to how these people doing. So when we look at clinics like in Mexico, we were down there in Mexico in many clinics, even with my partner, and we were seeing firsthand, like, how's this working? And when we found out that it wasn't, it was a shock. Because, grass is always greener. We hear like all these testimonials and stories, but like, where's the outcomes data? A lot of clinics, even a lot of retreat centers, they see thousands of patients every year. And that's good. But then I'm like, show me the data. Because marketing is marketing. You can always have your N of 1. You can always have your outlier. Some people can just get cured from their disease just by eating a plant-based diet. Some people just prayed all day long. Some people, they took the chemotherapy and it cured them, right? So there's always going to be those patients that we can use as star patients. However, when we look at the mass amount of people, where's the data? And I apply that, so I tell my patients right now, because we have a lot of patients that go to Mexico, that are going to Europe and all these things. And now, I used to be very open, and now that we've investigated those facilities, I mean, many of those facilities are actually not even medical clinics, they're hospices that people don't know. I mean, there's a dark side to, it's becoming medical tourism, but it's not outcome driven. It's financially driven. You're dropping $70,000 to $100,000. You're wiring it overseas. Blah blah blah. You're going to something there, and what are you getting, right? So everybody thinks it's one new thing. Every month there's a new IV therapy. There's a ozone hyperbaric. Oh, let me give this in IV, in vitamin C. We're giving all these things. I'll just give you an example with vitamin C. Although vitamin C has a role, and although IV vitamin C may show in certain aspects, there was 1.1 million doses of vitamin C that was purchased, I think, in 2017 in the US. And there's not one single outcome data of just a before and after in the clinic. So that means doctors have delivered something which clinics make a lot of money. Patients think that they're getting something because they want to pay for it, but it's not outcome driven. And if it works so well, believe it or not, how I think, because I talk about follow the money, that vitamin C would be now patented to be sold by a pharmaceutical company, and your insurance company would be charging you 10,000 times more expensive, and you'd be delivering it because if it works, we would want to take it and monetize even more, meaning the conventional pharma system. So we have to look at, if certain things are there, I'm evidence-based. So we always tell our patients, is it evidence-based? So I'll give you an example. When someone comes to our clinic and they have a specific type of cancer, they don't get the same thing as the next person. Everybody's cancer is different. We have to look at, in the literature every day that I see the patient, what is in the scientific literature that shows in vitro or in vivo studies showing efficacy of a natural ingredient interfering or supporting that cancer pathway. If we do that, we get really targeted therapies. But everybody says, well, just take all these things. Again, that's kind of like just take all these supplements, or just go into the sauna. And we have to be targeted because at the end of the day, people have limited budget and we have limited time. We have to get outcome improvement. So a lot of people will say, don't take chemo or don't take the herbs. It's like if you have the experience being integrative, you know how to improve that outcome by having a little bit of this sometimes, a little bit of this. And sometimes if the data doesn't show it's helpful, we move. Like I never give something that's not evidence-based. I start with those things first. If someone says, hey, I read about this, I heard it's good for you, I go, well, it might be good for you, it's great. I can't find any kind of data in vitro and in vivo that is helpful, so we put that as a secondary option. Because we have to start first, like if there's data to show this, why aren't we taking that? And if they're not, because most people aren't, they're just taking whatever something is somebody sold them, then we have to be outcome driven. So I like to ensure my patients that you have to look at, are they doing better than before? Do we have that data? And if there's clinics or facilities, whether it's just plant-based or whether it's alternative or whether they're in Mexico or Germany, or this, they have to show the data. Everybody will want to run from the conventional system. And sometimes I agree with them. I'm not saying that I would love these things, but we have to actually have the true kind of the realistic moment of are we improving their outcome, or did they just go outside the system and get have just as bad outcomes as if they went to this system? So that we have to look at how do we improve it directly, and that's what we do very well.
Can you sum everything we've talked about today up in 15 seconds?
Yes. So what the average person needs to do is read my book, An Inflammation Nation. We need to focus on lowering your inflammation through a whole food plant-based diet that's mainly organic as much as possible. We need to test for your food sensitivities, look at what your triggers are. We need to fix your microbiome. We need to strengthen your immune system. For the inflammation, we can take things like Boswellia SR, which is clinically tested and patented, and so it'll reduce your inflammation. We can take things like vitamin D and glucan 300 that will help support your immune system. We have to also focus on stress reduction, key doing meditation and yoga. We need to have community to help that. If you follow the 10 steps in my book, I will guarantee that 80% of your diseases will get better. And again, you need about 20% to have some kind of healthcare provider. But that's the first step that people should follow. Even if you don't have an integrative practitioner, that's the first step to achieving optimum health.
What is the one thing I must do today?
The one thing that you must do today is you need to understand that the body has an innate ability to heal. If you understand that, then the outcome that you want to achieve is achievable, right? A lot of people are limited in that belief system because they told, I have this autoimmune disease, or I have cancer, or I have diabetes, and it's a lifelong, I was born with it, or my dad died from it. If you believe that, then you'll be stuck with your epigenetics in that disease. And so it's really about being, red pill or blue pill, which are you going to take? And then when you take the red pill to be to gain the knowledge, you then have to put that in practice. So understanding that disease is reversible, disease is preventable, disease is treatable with natural therapies, and occasionally if we have to use conventional therapy, we can. But the idea is that the body can heal. When you cut yourself, you don't think about what happens, but the body's doing all these things to repair itself. Right? So if we just do the same things, like if you put the right fuel in the body, you put the right fuel in your mind, you have the right environment, then optimum health and wellness is achievable. We just have to have that belief system today, when most people leave this conference, is that that can be done. And if they do that, then that's the first step to getting well.
Why did you feel it was important to be here and speak at the Real Truth About Health conference?
I came to this conference for a reason that there was a lot of people that were speaking that are my colleagues in the field that have influenced me in my training over the last 20 years, and people like Dr. Colin Campbell and Dr. Esselstyn and some of my colleagues in the field like Milton Mills and Brenda Davis. These are people who've been really supportive in the concept of moving the science of the data, right? So a lot of these other practitioners are really good. They have books and they have ideas which are correct, by the way. But when I look at some of my colleagues that are more outcome driven, it's like we have to move the bar even further. And the only way to do that is by sharing data. It's by showing, here's a before and after. Here's your blood test. Here's your X-ray. Here's your angiogram. Here's your physiology. Because in order to change the system, we have to then encourage that data then gets into the masses. And so the goal of coming to speak here is because it's not pharmaceutically driven. It's not, there are sponsors, but the sponsors are different. Maybe some juices or something like that, and that can be whatever. Everybody needs a sponsor, but we're not pushing a drug. What we're trying to say is that if you change your lifestyle, whole food plant-based diet, if you kind of live more this plant-based lifestyle, or even organic lifestyle, whatever you want to call it, lifestyle, holistic lifestyle, that optimum health is achievable. And this is where, at this conference, we have that ability. You can hear from world's experts. My area is inflammation, integrative medicine, and formulation. But you hear from everybody. So cardiologists and GI doctors and environmental people. And if you hear it, then there's always going to be someone that has an aha experience in their mind. Like, that is the word, that is the sentence, that was the patient that they give an example that they relate to, and they start to change. So having this impact on this conference, particularly being online and being free, is key, because we need to get this information out, and we need to have it pretty much unrestricted as much as possible to have the real truth come out. So for those of you who want to get in touch with me, you can go to sanjevani.net, sanjevani.net, and learn about our Integrative Medicine Health and Lifestyle Center in Albuquerque. We do consultations in-house. We also do consultations via telemedicine. So we have people from all over the world, all over the country. We do telemedicine. We're able to send our testing kits and send our products and videos and information. So don't make distance limitations, because a lot of people don't have an integrative practitioner sometimes in their state, or even many states around, or some countries that we consult with. They don't have anybody in the whole country that does it. I act as a consultant, so I'm not a primary care physician, although we look at primary care aspects. We look at how, most people will have a specialist or 2 or 3 or 4 and a primary doc, and then alternative practitioners and natural practitioners. We're looking at how can we provide that full overall guidance with our expertise and kind of fine-tune the regimen with evidence-based practices. You also can come and look at my book, An Inflammation Nation, a critical guide here. It's critically acclaimed of the 10 steps to help prevent, reverse, and treat disease by diet, lifestyle, and natural therapies. It's all driven by the data. So again, almost 500 pages, but 1,500 references for those people who want to go further and deep dive into that. And later on this year, we're looking at a project of converting it into a documentary or docuseries, so we can go even further in that education. But you can go to aninflammationnation.com, aninflammationnation.com. You can also order it on Amazon or get it on iTunes or Audible. If you order through us, you can get a signed copy. What a great gift to give something to someone which is evidence-based, that will help change their life and bring them to optimum health.